Good afternoon, everyone. Thanks for joining us today. My name is Haim Yacobi. I'm a professor at the Development Planning Unit and the program leader of the Health in Urban Development Master Program, which is the newest program at the DPU. So welcome again and thanks for joining us. What I would like to do today is to share with you some of the ideas and the contents of the program, Health in Urban Development in general, but also I hope that it will give you a very good idea about some of the topics, contents that we deal with at the Development Planning Unit. So I picked, I hope, a provocative title today, Why Urban Health Justice Now? And I would like to start by saying that our starting point to understand urban health these days, especially after the last year and following the global crisis of COVID. So our approach or our philosophy is that we cannot deal with urban health without referring to a very central element in urban life, which is social justice. So our approach to urban health is contextual. We are looking at the people who are living in cities in the global north and the global south, and we are interested in understanding what are the links between urban processes and health and how it could fit into the framework of social justice. So what I would like to do today is, first of all, to start with a very general idea, which you probably, those of you who are studying maybe political science or sociology, came across. And this is the idea that cities are an open space. Cities are enabling different people from different groups to come together, to work, to live, to enjoy urban life. And cities are considered as a very liberal space in which people could liberate themselves from different, how could I say, from different backgrounds, and they could really live together. And this is obviously a very utopian and very specific point of view in understanding what cities are like. And we all like cities. And cities, as you probably know, host today most of the population in the world. So referring to cities or to urban territories is not arbitrary. It is really has to do with the current conditions that we all live in, that most of the population in the world already live in cities. And cities are diverse. Paris is not like Freetown, and London is not like Addis Ababa. And the diversity in cities and between cities is a very central element in the way we understand urban processes. And cities are a great opportunity to find education, employment, and cultural opportunities. Tolerance and diversity in cities are very often bigger or more significant than in the periphery or in the more rural areas. Density is a very important characteristic of cities, and it also enables the provision of services and social support. Finally, cities are very interesting spaces because they link global processes into local conditions. Think about immigration, for example. Migrants who are coming from one place to London or from another place to New York, they bring with them culture, they bring with them economy, they bring with them their networks, and you can really see how global issues are translated into local conditions. However, we shouldn't forget that cities are not just open spaces and liberal spaces. Cities are also about inequalities, segregation, conflicts, violence, and hence also health disparities. Cities also, I mean, we're witnessing in cities these days, and I think in general, high numbers of morbidity and mortality, And we can see that it has to do not just with cities in the global south, but also in cities in the global north. And maybe later I will say a few more words about it. Just, to give you a kind of a general idea, we can read, that's what I would argue, we can read urban history or urban planning history as the history of public health. And the development of cities, especially cities in the West or in the global North, the development of cities has to do very much with health crisis. And we can go back to the 18th and 19th century, and with the ongoing search for solutions to urban dwellers. What will be the ideal typologies that could host people in cities, and how it will give respond and answer to their health needs. But cities are also, or while we refer to health and planning and urban planning in cities, there are some dark sides to the story, which has to do with control over populations, with stigmas over populations. And again, I will not be able to expand very much, but in one of our modules in urban health, we are very much trying to understand how urban history links to public health, to social control, but also to some wonderful opportunities. So what really affects our health? And we refer to health in a wider sense. So we should understand that health has to do with the food supply, housing, economic and social relationships, transportation, education, and healthcare, obviously. And the distribution of urban goods in general and health services in particular very much affect our daily health. So think about, for example, the correlation between number of years of education and the health conditions of specific population. Think about employment, not just either you have a job or not, but also what kind of employment you have and what kind of environment you spend more of your time and how it affects your health. Think about poverty and access to food. Think about housing conditions, which apparently becomes a very central issue these days when we understand that people who live in very high density might be more exposed to transmission of COVID. Think about the issue of race and racism and discrimination. Think about segregation, all these issues, and obviously transportation that can enable us to mobilize ourselves in urban space. Think about all these daily conditions and how they affect your health. Think about people who have a relatively good open space next to where they live, and they could go outside, for a walk, to meet people, or even just to see people during lockdown, and how it affects their mental health. So it's not just about our physical health, it's also about our mental health. So we are trying to understand health, not just as a biomedical issue. Health is an urban issue, and it has to do with the daily experience and with our environment. Again, I will not go into the details, but the WHO, the World Health Organization, developed a whole concept of the social determinants of health that you can see here in the slide. And you can see that our life or our health is affected by individual, social, and community networks, and obviously the general socioeconomic, cultural, and environmental conditions. And it's very important to understand it. And I would say that this is maybe one of the main methodological frameworks through which we are working in our research and our teaching at the Health in Urban Development program. So what is health inequality? So I've mentioned, the issue of distribution, of unjust distribution of social, economic, and environmental conditions that are necessary in order to keep our health better. The unequal access to quality education, healthcare, housing, transportation, and other resources. And in many, many cities and in different research projects, you can see that there is a correlation between the location of your housing, what kind of infrastructure you have or don't have, and how it affects your health. And obviously the issue of employment that I've mentioned before that enables you access to to health services or to food. And discrimination, and maybe I will mention it later, discrimination which is based on social status or other factors such as ethnicity, gender, and in many cases, the intersection between the different social statuses. All these issues really affect create inequality in health of people who live in cities. And I think that the main question that we are asking ourselves, not as public health experts, but as urban health experts, is how comes that urban space, that we understand how important it is to the health of people, how comes that, we treat people, let's imagine, someone who is coming from an informal settlement and he or she were lucky enough to have access to the hospital to treat them. And then the day after, they are going back to their informal settlement where they are exposed to very problematic environmental conditions that affect their health. So for us, health is not just about treating people in a situation of crisis. For us, understanding the conditions that people live in and what kind of intervention strategies we can develop in order to make life better, this is, our main focus. So I've mentioned before that, we can see that urbanization is a very central process to the 21st century. But what you can see here, I hope that you can see my cursor. What you can see here is that urban processes or urbanization is much higher in the global south than in the global north. So inequality is not just in cities or within cities, it's also between regions. Okay, so this is something which, again, is a very central issue that we are trying to discuss in our modules. So we can see that non-communicable diseases that often emphasized, richer societies also started to affect poorer societies also in the global north. And it has to do with access to food or what kind of food people have access to. We can see that in poorer countries, HIV, for example, or malaria are still very, very central to the health challenges that they have. And it's a very important point because we should understand that there is a gap, still a very dramatic gap, unfortunately, between cities in the global north and cities in the global south. And this is a good example. You can see some of the data from about Africa, and you can see that very basic needs, such as water and sanitation, or access to basic health services, are very much the challenges that we have to face these days in the global south. And it brings me back to our current days and to, I would say, to the crisis that we are all going through in the last year or so. And I think that it gives us a very good opportunity to rethink and appreciate the importance of urban health. And for example, in the latest article, Richard Horton calls to understand the current conditions as a syndemic, within a syndemic approach, i.e. to understand how health it cannot be understood only as a biomedical treatment, but also in a way to try to understand health in relation to the wider conditions that people live. And the integrated approach that is calling all of us to join is a very important one, and I would say a very central one to the Health in Urban Development Master Program, because we see the biomedical or the epidemiological or public health issues as very, very important, but we are trying to add to it or to frame it in relation to what we urban experts are interested in, i.e. planning, space, urban politics, and so on and so forth. And I think that the current crisis, COVID crisis, is a very important opportunity to us to rethink urban health justice. Because, issues such as washing hands or locking yourself in your house is something that might be relevant to less than 50% of the world, I would say. Many people who live in informal settlements and don't have access to sanitation, to water, or living in very, very dense or very problematic housing conditions, for them, the idea of washing hands or isolating themselves is not relevant at all. So what is very, very clear to us is that infrastructure, planning, policy, housing, open spaces are becoming very, very central element to heal, I would say, our urban societies. And here I would like maybe to share with you two short descriptions of two research projects that I'm involved in. One has to do with the city of Gaza in Palestine, where there was in the last decades, I would say, an ongoing violence and destruction of infrastructure, including water, electricity, sewage systems, environmental habitats that were completely destructed. And what we found in our research is that, and you can see it here, all the destruction of infrastructure affected the health of people who are living in Gaza, not just their physical health, as you can see here, but also, for example, what is the psychological effect of violence, ongoing violence on the mental health of people. And so, for example, one of our shocking findings was that the number of young people who are committing suicide becomes higher and higher during the years. And it is also important to mention that the destruction of health systems, starting with clinics and ending with hospitals, is very, very significant to the deterioration of the health conditions in the city or in the Gaza Strip in general. So the question is how it affects people in Gaza these days. And again, I'll go back to the question of washing hands, living with your extended family, and when you need to isolate yourself because of COVID, what can you do with it? And obviously, and I just want to bring some voices, we interviewed people in Gaza to understand how they cope with COVID. So, for example, one of them told us that the families prioritize purchasing bread and fundamental items rather than sterilization materials. Our children are playing with each other outside and not follow the safe isolation procedures. So you can see that under specific conditions, spatial conditions, people have great difficulties to keep distance or to use infrastructure. Or, for example, another interviewee who said that we found some non-compliance of our rules, and therefore we warned some mosques to close and put our own monitoring committees at every mosque, etc., etc. So you can see that communities, even in a very extreme case of violence and destruction of infrastructure, there is some agency or some sense of resilience to communities and community institutions in order to support the current crisis. Another example, which is completely different, but again, I think very important and has to do with the notion of justice, I would say, is another project that I'm involved as a wider team on Addis Ababa. And what we are trying to do is to see how COVID affects the life in Addis Ababa. So what we found, and this is very interesting, that obviously transmission and the most cases started in the poorest areas of the city, mainly the unplanned or the informal parts of the city. And this is obvious, I think, following my previous slides. But what we found very interesting is that currently one of the areas which is a better off area, planned and formal, that suffers heavily from COVID is located relatively far from the previous cases. But also what is very interesting is to see that COVID has no borders or boundaries, okay? So the interest in creating a just system that enables people to live a healthy life in cities has to do also with the interest of the better off population. But I think we can also understand it in a different way. For example, the fact that people who live in a better off neighborhood, they have access to clinics to check themselves. So the data is also something that we need to question. Is it possible that in a better off neighborhood, people will suffer more from COVID than in the informal areas? The question is, we don't know. But what is very interesting is to see that the boundaries that we imagine when we see or when we visit cities don't really exist or they are limited these days. So what is urban health justice? And I think this is something which is very, very important, and I hope that you will be able to keep it for yourself. The first has to do that we need to focus on the allocation of resources, and resources could diverse from infrastructure to housing conditions. And we need to be proactive. And I think this is a very important lesson that we all have following COVID. We need to create a better spatial conditions in cities in order to be able to cope with crises such as COVID. And what is very important is to understand that it's not just about space that provides physical infrastructure, but also a question of urban governance, also a question of developing institutions such as the mosque that I've mentioned in Gaza, that will be able to support communities in a moment of health crisis. And what is the most important message that I would like to deliver, that we should rethink the connection between public health and urban planning, that historically were developing, I would say, as twins, but then they've separated. And our aim is really to start and understand how can we match, or how can we bring back urban planning and public health into one discipline that will support the health of urban dwellers. So thank you very much. And please, if you have any questions or any comments, feel free to write it in the Q&A box that you have. Do we have any questions or any comments? Katie Roberts, this has been really inspiring. Thank you. Could you talk more about the relationship of public health justice and climate change? Okay, you are very welcome to one of our modules next year. Yes, I think, climate change is maybe one of the most urgent topics that we are dealing with these days. And our focus is very much on how communities could cope with climate change and how it is linked to their health. And obviously, changes in temperature during summer, for example, in some areas of the world are crucial if we want to understand how communities could survive it, especially poor communities living in informal conditions. Or, for example, what kind of mechanism of resilience communities could develop in order to cope with climate change in order to reach better health conditions. So we are really, we have a whole section in one of our modules which focuses on this topic. Thank you, Katie. Anyone for another question? You're very welcome to email me, guys, if you feel, later that you want to ask something. Fui, hi Fui, great to see you here. Could you expand on the connection between public health justice and planning? Yes, obviously, public health and I think, it's interesting. We forget for a moment the notion of the word, of the term public. And I think this is a key to answering your question, Fui, because I think cities or urban planning is first of all about the public sphere, about the public interest, about the public good. And the question, what is the public good? Is the public good developing highly privatized urban spaces that people cannot use? I would say no, just the opposite. The public interest is to develop open spaces that people could use, especially we can see these days that areas, neighborhoods, cities that have good green infrastructure, it enables people to cope with a lockdown, for example, much better. So what I would like to say is that planning as a discipline is very much linked to some of the health crises in the 18th and 19th century. And planning was the medicine, if you want, to some of these issues. So the fact that we have infrastructure such as water supply or sewage systems, it has to do first and foremost with the issue of the health of people who moved to cities in the 18th and 19th century. Again, this is something which we discuss in much more details at the very opening of one of our modules, also I hope next year. Urwa Shahid, can you shed some light on public participation in achieving better conditions? I hope that I guess that you're talking about health, better health conditions. Yes, one of the issues that we need to take into account is that intervention in urban space, even if it's, for example, to improve open spaces, to improve infrastructure, to improve housing conditions, this cannot be done top down in general, and I would say in some areas of our cities in particular, because the way in which communities use space on a daily basis, the way in which communities know what is good for them and what is not good for them is something that we as planners must take into account. And we cannot really we're not in the 40s and the 50s and even in the 60s that, planners were those who knew everything and even better than the users. What we know today is that in order to make a better plan or a better space for use, we need to understand the needs of the users, their priorities, their ability to cope with changes, etc., etc. Okay, we have some time. I'm from Indonesia. I would like to ask your opinion about the current conditions in pandemic. Has it already justice policy for some cases in the global south? I don't know if I understand fully your question, but I think what we can see is that, and some scholars have already defined it as global medical apartheid. What we can see is not just that the conditions between global south and global north are, different in some of the cities, but also the way in which, for example, vaccination is circulated in global north and global south also obviously create a situation that many of global south countries and cities will cope with COVID in a much longer delay than we deal with these days, for example, in London. So I think that the COVID COVID just exposed the weaknesses or the gaps or the unjust or the unequal or inequality gaps between cities, within cities, but also within regions. Andrea, great presentation. Thank you, Andrea. In my practice, I often find that locally citizens are often very capable to take on the task of improving the health of the community. I was wondering if you have any examples of how the community's work could be elevated to policymakers, local or national, so they can create a more enabling policy environment to advance urban health. Oh, very, very important and very difficult question, but I tend to agree with you. I think communities know better what is good and what is bad for them. And I think that if we want to develop an intervention, it could be spatial, it could be social, it could be economic, and we want the community, and we will involve the community, I'm sure that they could do it better. These days, I'm working with our students at the Health in Urban Development Master Program on a project, research project that we're doing all together in Nicosia in Cyprus. And we have a very big question around refugees who arrive from the Middle East to Cyprus and especially to the area of Nicosia. And one of the things that one of my group of my students are trying to do is to try and develop some guidelines for intervention to improve the health of refugees in Cyprus with this, with a kind of ongoing dialogue with these refugees. It's not easy because, again, we have to do it online these days, but students are doing it quite successfully. And the idea is to try and look or refer to refugees in this case, not as patients, but as partners. And I think this kind of change is very, very dramatic and very important if we want, in my view, to develop better strategies of interventions around urban issues in general and urban health in particular. Anonymous is asking whether urban design could take more of an active role in the global south. What are some of the challenges urban designers face? Thank you very much. I think it's a very important question. When I was much younger, I was studying urban design with Professor Jan Gell at the Royal Academy of Art in Copenhagen. And Jan Gell was, I think, one of the pioneers of urban design, I would say, in the world. And today, when I'm dealing more with urban health, I'm going back to his work, to his philosophy. And I see how important, and it is linked to a previous question, how important it is for urban designers to focus on public spaces, on public interest and public good as the subject of their intervention. And I totally agree that urban designers have more or a growing role in the global south because the scale of intervention is not a wide scale of planning, but a more micro scale of urban design. And I think also the potential to involve communities in this process is is higher than in a big planning, master plans, etc., etc. So thank you very much for this question. Speaking about this is Mahatab, speaking about what urban health justice is, in the diagram, there's also open spaces. Could you please explain more about the role of open spaces in urban health justice and would recommend some literature? Thank you. So feel free to email me. I'll send you a whole list of literature, okay? Because again, this is a very central topic in our modules. But I think that we need to understand, and it is also linked to climate change. We need to understand how important it is to develop open spaces, green open spaces in cities, okay? So we know that the contribution of green spaces, which are designed correctly, to the well-being of people, mental and physical well-being, as well as to the environment, is something which is significant. So if you want to lower temperature in a specific area, if you will have the right intervention in landscaping, in trees, in greenery, et cetera, you can do it. And we have many, many cases that we analyze, and you can see that it works out. The idea is that open spaces will also be for the use of people and not just for the environment. And I think this is something which I personally feel that is the challenge. You know, we need to try and develop green structures or green infrastructures that will serve people and an environment at the same time. I think that we have, we have some questions at the chat and not in the Q&A, which is fine. I'm happy to look at it. There was a question from Sarah Sabet. Thank you for your lecture. I want to ask about the methodology in DPU. What kinds of methods are common in the DPU? Quantitative, qualitative, or both? So, you know, I think it's, you know, it's an important question, and the answer is simple: both. And the reason is that we have 7 different master programs. Some of them focus on urban economy, some of them on sustainability, on health, on urban design, and within each program, we have different people with different approaches. So the question, what kind of methods we need to use, has to do with the question that we are trying to answer. If we are trying to understand how communities cope with COVID, as I've illustrated before, you know, we can interview people, and this is a more qualitative method. If we want to understand how COVID spreads in Addis Ababa, we have to deal with numbers. So, you know, it depends very much on the research question, I would say. But we have experts in different methodologies. For example, mapping is something that is very, very much developing the work of many of my colleagues at the DPU. Okay, if we shared something on, yeah, okay, I think that we have, are there any other question, guys? Feel free. Okay. So again, I would like to thank you for joining us. Please feel free to visit the DPU website and have a look at each program. And if you have any questions that has to do with the contents of the program, feel free to email the program leaders of each program. And if you have any questions about health in urban development, please feel free to contact me.